Countless people have them, and you know what? Many of them will never talk about it. Do you want to know what it is? Can you guess? Hemorrhoids. That's right, I said it, hemorrhoids. And you know what? They affect millions of people whose fear of archaic, ineffective, and painful treatment options prevent them from getting the help they need.
People have this misconception of hemorrhoid treatment because they wait and they wait and they wait when they can. As soon as they have problems, they should get them treated. Nobody really likes to talk about hemorrhoids. They find it embarrassing and personal. But I see patients from age 20 to 80, men and women, who've had problems for a long, long time, and they've just not wanted to talk to their doctor about it or see a doctor about it. Usually what I hear is, I wished I'd done it years before. I wished I hadn't waited so long, gone through all this. Because it does affects life with the bleeding, the pain, the embarrassment. And it doesn't get better, it slowly gets worse over a period of time. What causes them? Some people, they run in families, pregnancy, age. Older people tend to get hemorrhoids. In the early stages of hemorrhoids, when they first start to bug people, they go to the pharmacy and they buy over-the-counter ointments, which help for a while. But then as they get bigger and bigger and more painful, and then the ointments don't work anymore. And then they need something surgical done for them. There's all kinds of ways that people treat hemorrhoids. Some doctors ban them in the office. The reason it doesn't work well is that the exposure and the visibility is too poor. You can't get them where you want accurately, and it can be uncomfortable and patients don't like it. So I've stopped doing that. Some people use the infrared on small hemorrhoids, and that often works up to 2 or 3 months. But after 3 months, you've got to have a series of treatments again. And it's as expensive as having your hemorrhoid surgically removed, so you might as well get them removed in the first place. Because most hemorrhoid surgeries are permanent. Hemorrhoids just don't come back because of the nature of the hemorrhoids. They're a varicose vein, and once you remove the varicose veins, they don't come back. The interesting thing is that in general surgery as a whole, there have been enormous improvements technically over the last 30 or 40 years. We're doing robotic surgery now. We're doing all kinds of really clever things, but hemorrhoidectomy hasn't progressed in 150 years. People still want to do it the same old way. Patients don't want it done that way because they've heard from their friends just how bad it is. And with the advent of the laser, this is no longer necessary. 20 years ago, people started using lasers in surgery. They started using them in the uterus. They started using them in the eye. And I thought to myself, wow, this is a really slick treatment because it is so uninvasive. You're not cutting with a scalpel or scissors. You're using a really precise instrument. For the last 150 years, surgeons have been excising the hemorrhoids with the scissors and then sewing up the hemorrhoid bed. The trouble with this is it heals slowly, it's very painful, and you can be weeks of loss of work, inability to do almost anything until they heal. There have been some improvements, but the biggest improvement, as far as I'm concerned, is the use of the laser. And the reason for this is, we learn when we're learning to be surgeons that the less trauma you do to the tissues, in other words, the less damage you do to the tissue, the faster they heal and the least painful they are. So when you use a laser, it's far more gentle than cold steel. It actually vaporizes the hemorrhoids, and you can use the laser to even vaporize small hemorrhoids which get left behind when you use surgical scissors, because there's only so much you can take off. With a laser, you're unlimited. So there are no hemorrhoids you can't really fix with a laser. I use a carbon dioxide laser, which uses a cylinder with carbon dioxide in, where you pass a very high current. It energizes the carbon dioxide to produce a light at a very high frequency. The light is then passed through lenses until it's a beam, a colorless beam, and then that beam will do one of two things. If it's focused, it will cut. If it's defocused, it'll vaporize. So we use a combination of focused laser beam and unfocused laser beam to do incisions or vaporizations. When the beam is focused to a point, it will cut the tissue like this. The good thing about the laser is, as you can see from the other side, it only cuts very superficially, so you can control the depth of the cut accurately so as not to damage other tissue. This is used for removing large hemorrhoids. The smaller nuisance hemorrhoids can be removed by vaporizing them with the beam unfocused like this. And it'll very gently, slowly vaporize the hemorrhoid off the tissues, doing little damage. And again, if you look at the other side, it didn't even cut through this narrow tongue blade. We used to keep patients that had hemorrhoidectomies in the hospital for 10 days. We do the laser treatment as an outpatient. The family member brings them up. We give them intravenous medication, which more or less knocks them out for a short period of time. And during that period of time, we laser the hemorrhoids off. We make sure to put lots of long-acting local anesthetic in the area so that when they wake up, they're not in pain, so that they can get over that first hump of pain because there's long-acting local anesthetic being injected into the area. And then they go home. The laser is less traumatic, therefore the patient heals more quickly and it's less uncomfortable. Recovery really depends on the gravity of the hemorrhoids. It's just a matter of following our instructions and they're back to work usually within 3 to 4 days. My name is Dr. Peter Thomas. I'm a board-certified surgeon. I specialize in colorectal surgery and I'm a caring doctor.